More than 200 years after the epidemic in London, scientists finally identified the source of plague. In 1894, an epidemic of bubonic plague in Hong Kong killed 80,000 people. The governor, Sir William Robinson, called for scientists to come to Hong Kong to search for solutions and save the city. A famous Japanese scientist, Shibasaburo Kitasako, answered his plea. Shibasaburo's arrival was celebrated in the papers, and he was given his own laboratory and a staff of assistants. Nobody paid much attention to another foreign researcher who answered the call for help. Alexander Yersin was a young Swiss bacteriologist, a specialist studying disease-carrying microbes and how to cure or treat the illnesses they cause, who had been practicing medicine in the French colony of Indochina, now the countries of Vietnam and Cambodia. As an unknown scientist, Alexander didn't get the same warm welcome as the famous Shibasaburo. The Hong Kong officials didn't even offer him a laboratory. He had to pay to have his own lab built, a lowly straw hut not far from the much grander building occupied by Shibasaburo. The two scientists were soon racing to be the first to discover the source of plague. The competition was so fierce that Shibasaburo tried to prevent Alexander from getting access to the bodies of plague victims. Alexander had to bribe the soldiers guarding the plague wards of hospitals to bring him the blood and tissue samples he needed. That June, each man announced that he had successfully isolated the bacteria that causes plague. At first, Shibasaburo was credited with the discovery, but then the scientific community decided that Alexander had been first, and the bacteria was named Yersinia pestis in his honor. A few years later, French researcher Paul-Louis Simond discovered that fleas called Xenocelia sciapis transferred the infection from rat to rat. When a rat died, its fleas sometimes jumped to a nearby human. Their bites passed the disease to humans. It took nearly 40 years for Simond's research to be accepted by the scientific and medical communities. But the mystery of plague was finally solved. The future of plague. Today, plague can be successfully treated with antibiotics if patients get medication in time. But the disease is still a feared killer. In 1993, South and Central India were rattled by a severe earthquake that damaged a number of cities, including Bangalore, Bombay, Hyderabad, and Madras, as well as many smaller villages and towns. In the earthquake's aftermath, huge shanty towns and slums sprang up to house people who had been left homeless by the disaster. The shanty towns also sheltered large numbers of rats. In September 1994, plague broke out in one of the largest slums in the city of Surat. 55 people died, an insignificant number compared to the terrible death tolls of the medieval plague epidemics, but enough to make headlines around the world. Commercial air traffic to and from India stopped. The stock market in India crashed, trade halted, and the media went crazy, speculating about the possibility that plague could spread to other countries, triggering a massive pandemic. Luckily, it didn't happen. Although plague is considered a disease of the past, it is alive and well and living in rodents around the world. Plague is endemic in part of Africa, including the island of Madagascar, where the disease infects a few hundred people each year. In 2017, Madagascar had an outbreak of plague that was traced back to a man who developed symptoms while traveling across the island in a shared public taxi. 31 people who came into contact with him came down with plague, and 4 people died. The World Health Organization considers plague a re-emerging disease, a possible threat that requires constant monitoring. Addicted to statistics. In 2020, the world tracked the emergence of new cases of COVID-19 day by day and even hour by hour in the news and on social media. In 1665, people watched the numbers published in the bills of mortality just as eagerly. At least 5,000 copies of the bills were printed every week, and people snatched up the latest issue to find out which neighborhoods had new cases and whether the epidemic was showing signs of slowing down. The bill of mortality, to all of our griefs, is increased by $3.99 this week, and the increase is general through the whole city and suburbs, which makes us all sad, wrote Londoner Samuel Pepys on November 9th, 1665. Anyone following the toll of COVID-19 deaths in the news and on social media would understand just how Pepys must have felt.